been in this situation where you were diagnosed with mild sleep apnea and you were told, oh, well, you know what, don't worry about it. For mild sleep apnea, really doesn't need treatment. Yet you are waking up tired, your mood's all over the place, you're on multiple blood pressure medications, and you're really just at a loss for what to do. And exactly that is what my patients sometimes experience. And that's when they come to see me and we're kind of unraveling all of this. So in this video, we're really going to be talking about mild sleep apnea, when to treat and how to treat it. So if you do not know me, you want to follow this page because I share so many tips on how you can optimize your sleep to thrive and reach your fullest potential. And I'm Dr. Funke Afolabi-Brown, the founder of the Restful Sleep Place. So here's the thing. When we talk about sleep apnea, we're really talking about pauses in your breathing during sleep. And I have done a lot of videos talking about this in multiple scenarios and things like that. But today I want to address the mild sleep apnea because I've started seeing a lot of people go untreated with something that has absolute treatment options. So let's start off with what is mild sleep apnea. Now, when you have sleep apnea, what happens is you get a sleep test or a sleep study that can be done at home or in a lab. And that helps to quantify the severity of your sleep disordered breathing, right? So apnea, hypopneas, these are the pauses you have during sleep. They're added over the course of the night, and then they're divided by the total number of hours of sleep you had to give this apnea hypopnea index. What I do not like about this apnea hypopnea index is that it's not really taking into consideration a lot of things that are going on. Yet, this is what a lot of insurance companies use to pretty much decide whether you can get treatment or not. Mild is when you have an apnea hypopnea index or AHI of 5 to 14 events per hour. Moderate is 15 to about 30 events per hour. Then greater than 30 events per hour is what we would call severe. So most people focus on the moderate and the severe, and people don't talk as much about what's going on with the mild. And there are going to be a few factors that you want to consider when you're saying a situation or a sleep apnea is mild. One of those factors is how are you feeling? Most times, it's how you're feeling that prompted the study to be ordered in the first place. But you know what? Sometimes that's not even taken into consideration. So here are just some really practical things that will help us determine if your mild sleep apnea can just be observed versus really treated as if it's moderate or severe. The first one I talked about already is the apnea hypopnea index, right? If it's mild, moderate, severe, that's one thing. The second thing you have to realize, which is also being measured during your sleep study, are your oxygen levels. So oxygen levels throughout the course of the night. Because if you think of what happens during sleep apnea, you have these pauses in your breathing. Literally, your oxygen gets cut off temporarily over the course of the night. How low does your oxygen go? That's what we call the oxygen desaturation index. Is actually a suggestion of how much severe your apnea is. So if you have mild apnea, but your oxygen levels are going down to the 70s, please, let's pay attention to that and let's get that treated, because there is no situation where your oxygen that's persistently in the 80s or 70s is normal. So that's the second thing. Number one is the apnea hypopnea index or AHI. The second thing is the oxygen levels. The third thing are red flag symptoms that if you have, we need to treat that mild apnea as something that's more serious. One is excessive daytime sleepiness. If you're tired during the day, you're falling asleep while driving, you're falling asleep when you're sitting and just relaxing, you're falling asleep during conversations, all of that is suggestive that you have a lot of impairment, even though your apnea is mild. And we have what we call an Epworth sleepiness score. This is something, it's a very practical tool that we use to determine the degree of your sleepiness. If your Epworth sleepiness score is usually greater than 10, that is abnormal. So I could say your sleep apnea is mild, but you have significant impairment because of your high Epworth sleepiness score. In that case, yes to treatment. Another thing that we want to consider is if have you having witnessed pauses, right? If you have a spouse who's saying you're literally stopping breathing, it's scaring them, you're gasping, then you're very symptomatic, and that is something that we need to pay attention to. And then another red flag symptom is increased night wakings. If you're having so many disruptions, and I describe this to some of my patients, imagine that those pauses you have in breathing is like someone putting a pillow over your face intermittently all night long. Now, it sounds really graphic, but you get the idea. So if you're waking up multiple times because your brain is at alert to breathe, that's abnormal, even though your AHI is mild. So that's a red flag symptom that I want you to pay attention to. And then number 4, consideration are high risk, or what we call comorbid factors. So these are conditions that if you have that and you have mild sleep apnea, please do not stop, do not pause, do not wait and go, just go straight and go get your treatment. One is high blood pressure, especially if you're being treated on medication, you're trying all kinds of lifestyle interventions, and your blood pressure is still high, and you have mild sleep apnea, check. You got to get treated. Number 2 is things like diabetes, because we know that if you have mild sleep apnea and your breathing is interrupted during sleep, it's going to affect your metabolism. It's going to affect the way you regulate insulin. Check. You need to get treated. Another one is heart disease. Again, hypertension, like I talked about, but stroke, heart failure, abnormal heart rhythms, all those symptoms, all those diagnoses, those are huge risks that you're not going to wait around with mild sleep apnea and have those conditions. You absolutely need to get it treated. And then, things like mood disorders, depression, anxiety. If you have that, and even though your sleep apnea is mild, you need to get it treated. So we've talked about various things, the AHI, the oxygen level. We've talked about the high risk factors, and we've also talked about the red flag symptoms. So what are the treatment options for mild apnea? I think sometimes this is where people get stuck, because people hear it's mild apnea, I do not need that big machine, the CPAP. And I have a whole video that I did where I really delved into so much detail about how CPAP works. Don't be scared. You're not going to look like Darth Vader. Or maybe you will, but at least you'll be breathing well, right? So that's something I just don't want you to close your mind, to keep an open mind to this. This is so important. So number 1 is CPAP, continuous positive airway pressure. And that is a device that you use overnight. It comes with a compressor. It is, it pumps air to the back of your throat so that you can breathe well through the night. You could sleep well. And there's a nasal mask, there's full face mask, there's so many masks, there's so many options available for that. Number 2 is the oral appliance. These are fabricated specifically for you, designed to really open up that airway to help you to breathe better, so that once your airway is open by moving your jaw forward, air gets into the back of your throat, you're not suffocating all night long. Number 3, I would say, is weight loss. So if you have increased weight, you're obese, usually maybe your BMI is, above like 25 or close to the 30s. This is something you want to pay attention to, or over 30, because lifestyle modifications to lose weight can help. Then also there are medications now that are FDA approved to help you with addressing the weight issues, and even just a 10% drop in your weight, okay, can drop your apnea-hypopnea index by about 25% in some studies. So this is definitely something you want to pay attention to. And then positional therapy, I would say, is another option where you're really just trying to avoid laying fully on your back while sleeping. Because we know that when you lay fully on your back, it makes apnea worse. Your throat and your tongue kind of falls back, and it tends to cause more collapse and more apnea. So usually we'll do different things for positional therapy. Maybe you get a bunch of tennis balls and sew it into a t-shirt, or wear a fanny pack and stuff it with tennis balls or something hard that will make sure that you're sleeping on your side. And there's specific pillows as well that can actually help you to achieve that. So you're not kind of taking all your tennis balls and putting them in fanny packs and all of that. But positional therapy is a viable treatment option as well. And then finally, I would say surgical options are also, right? If you have a deviated nasal septum, if you have a polyp, if you have big tonsils, stuff like that. These are all options that can help you with ensuring that your mild sleep apnea does not go untreated. So we've talked about a lot of things, but I hope this has opened your eyes and your ears and your mind to seeing that mild sleep apnea is really relative. What does that mean, right? And so really figuring out how is it impacting you? Because what is mild for one person may actually be severe for someone else. And so reducing the severity of your apnea to just this index, this number, without taking the whole picture into consideration is a disservice. And so this is really what is unique about our practice. We're looking at the whole picture. How does it impact you? What's your day like? What's your function like? What's your mood like? And then we customize a treatment for you, because there's no one size fits all, right? What may work for one person may not work for someone else. I've had someone try CPAP, they loved it and their lives are better. And I've had other people say, do not bring that device close to me. And so we figure out what works for them. And really, that's why we have this very holistic approach to our care at the Restful Sleep Place. And we would love to help you navigate this journey. So give us a call, 215-607-8297. And listen, be a sleep evangelist. Help me to get the word out. Share this with someone who you think may be struggling with sleep, somebody that is wondering what to do with their sleep apnea, and someone who's maybe snoring and they're scared to get a sleep study because they don't want to be diagnosed with sleep apnea because they don't want to look like Darth Vader. Share it. There are treatment options that can work for you. And until next time, I hope you rest well.